Hey everyone, this is Dr. Boyd. Welcome back to Parently. Today we're talking about a very important subject. Now, I encourage you to hit the link below and join us. We have many videos as it relates to pregnancy, as it relates to labor, as it relates to you as an individual pregnant woman. So, how do you know if you're in labor? It's the single greatest question late in pregnancy. We talk about it in the office. Many patients come into the hospital in false labor. So we want to encourage you to listen to me today so that we can show you what true labor is. Your uterus has your baby inside. It's the passenger. You're the driver. But the passenger at some point has to come out of the uterus. That process is labor. So it's just like pushing a car. It's laborsome. The uterus will contract. And that process, through regular painful contractions, will push your baby out of your vagina and you will be a happy mom. But how do you know? How do you know if it's true labor versus false labor? So, labor is the process of the uterus starting to contract, starting to become painful, and pushing your baby down into the birth canal and subsequently out through the vagina. So we talk about regular contractions, painful contractions, and timing. Those three things are the most important. So when labor starts, it is a process where you will have contractions every X amount of minutes. So we're just going to use some time scales here. So when your process of labor starts, you're going to go from 20-minute contractions down to 10-minute contractions, down to 5-minute contractions, down to 2-minute contractions. Now, they're not 20 minutes long, 10 minutes long, 5 minutes long. The time interval from one contraction to the next contraction is what we're talking about. So, if you've been contracting, on almost all women do late in pregnancy, on average you'll have 4 to 6 contractions per hour. You can feel them. Your uterus becomes firm, but they're not painful. Sometimes they stop you and you definitely notice that they're there. We call that uncomfortable, but we don't call it painful. So it's the beginning of one contraction to the beginning of the next contraction. When that interval is 2 to 4 minutes apart, then you know you're in true labor or active labor. And it has to be there for several hours. You don't just get to that point and rush to the hospital, because you can get a regular contraction pattern, but then they go away. So I encourage you, when you've had the 20-minute down to 10-minute to 5-minute down to 2-minute contraction interval, that you wait a bit, several hours, to make sure it continues. Number 2 is the pain. So, what is pain? And people talk about it all the time. It's your arm getting cut off. It's your leg getting cut off. It's your belly being split open. Those are all the type of pain that you will experience in true labor. Now, it's scary, but it doesn't have to be scary. So a lot of it's preparation. I've told patients for years and years and years, nobody will ever die from pain. You may feel like you're going to die, but you won't die. Pain doesn't kill you. It will cause anxiety. It will cause, oh my word, I don't know if I can get through this, but you will not die from pain. Promise you. So, pain threshold of 10. That's the most intense pain you will ever experience. And you have to imagine something that is that level. So if you're at home and you're asking yourself this simple question, is this pain the worst it's going to get? Or is this pain that I'm experiencing, is this the real thing? Then it's probably not. Again, go back to the question, is my arm just being cut off? You don't have to ask yourself, am I having pain? You know, you look down, your arm's gone. You know you're in severe pain. And labor is the exact same way. You will know it, I promise. So, number 1 is interval. Number 2 is pain. Number 3 is the length of time that you're doing this. So when the interval gets to be 2 to 5 minutes apart or 2 to 4 minutes apart, and you're having this severe pain, wait at home. We would like you to come to the hospital when you're 5 centimeters dilated. The cesarean section rate in the United States is about 1 out of 3 pregnancies. If you come into the hospital after 5 centimeters, your cesarean section rate gets cut in half. So you go from a third, or 33%, down to about a 17 or 18% chance of cesarean section. Those are great odds. But it's 5 centimeters or greater when we see that. So encourage you, when you get to interval times, 2 to 4 minutes, you have severe pain, that you wait. Now, the big question that everybody asks is, how long do I wait? I can't answer that for you. Now, babies don't just fall out of your vagina. They just don't. Even ladies that have had multiple babies, the baby just doesn't fall out. Now, you hear of deliveries in the car, in the taxi, but those are rare. In a given year, I will only have 1 or 2 patients that delivers outside of the hospital. So it's very, very uncommon. Women almost always get to the hospital on time. So waiting as long as you can at home is better for you and your baby, and it lowers your cesarean section rate in half. So I encourage you to stay at home for as long as you can. Let's talk about, though, a very important subject for all women. What if my labor fails? What if I have a failed labor and end up in the cesarean section room? How do I prepare for that? The first way to prepare for that is understanding that in the United States, 1 out of 3 pregnancies results in a cesarean section. So you have to be prepared in your mind that you may end up there. That's not our goal. We want you to deliver vaginally. It's much safer for you. It's healthier for both you and your baby if you deliver vaginally. You go home, you return to your life in a much quicker fashion than if you have a cesarean section. Remember, a cesarean section is a surgery. We're opening up your belly, and you have to understand that there is a recovery time. And the recovery time is several-fold longer than a vaginal delivery, several weeks longer. In some women, several months longer. And remember, once you have that first cesarean section, it increases your chances that you're going to have a second and third cesarean section. So if we can lower your risk for a cesarean section the very first time, then we improve your chances of delivering vaginally the second, third, or fourth time. But we have to be prepared for a cesarean section in the event that you end up there. So what's the most common reason that women end up in a cesarean section? Well, there's 2. One is fetal intolerance of labor or fetal distress. There's several terms that we use in obstetrics. That means that as your uterus contracts, trying to expel your baby, that sometimes it compresses the umbilical cord, sometimes your placenta just is not adequate to allow your baby to go through the process of being squeezed. And so the heart monitor of your baby will show what we call bradycardia. That means the heart rate will go down. Now, after we see that several times in obstetrics, sometimes the obstetrician says, we can't do this anymore, the baby doesn't tolerate labor, and you end up in the cesarean section room. The second reason that women end up in the cesarean section room is because of the inability to deliver vaginally. We call that failed labor, failure to descend, failure to dilate. Remember, there's 2 processes that have to occur for your baby to come out vaginally. Your baby has to descend in the birth canal, that means come down. And then the second thing your baby has to do is it has to dilate your cervix. The cervix dilates oftentimes with the head of the baby pushing down on the cervix, and that allows the cervix to open up so that the baby can come down. So 10 centimeters is fully dilated. If the cervix never gets to 10 centimeters and you've been in labor for a long time, you've had regular contractions, painful contractions, then we call that failure to dilate. If the baby's head does not come down into the birth canal, then we call that failure to descend. Both of those end up with the patient eventually in the cesarean section room. There's no way to know when you start labor if you're going to be a failure to dilate, failure to descend patient, or if you're going to have fetal intolerance to labor. Any of those conditions can necessitate a cesarean section. So a cesarean section is not a failure. It is simply a different pathway to our ultimate goal, which is getting you a healthy baby. So we want you, from our standpoint, obstetrically, from teen parently to deliver vaginally, we want you to have a wonderful experience. But if you don't deliver vaginally, we encourage you to be prepared for cesarean section. It's not a failure. It's simply a different pathway to get your baby in your arms. Let's get ready for labor. You're going to do great. You're going to deliver vaginally, and you're going to have a great experience.
Hey Mama, I'm Annabelle, nurse and doula for Teen Parently, and I want to take what Dr. Boyd said and really break it down for you because he's a physician, he is a doctor, and he is extremely intelligent, and sometimes doctors think in all this medical jargon, and sometimes it's hard for us as moms and women to relate and really feel connected to what they're saying. And so I want to give you some practical steps of what Dr. Boyd was talking about in his amazing video that he just did for you. So I want to talk about normal labor. So you have a contraction and it starts and you start to feel the pain and you're like, okay, this is a contraction, it's peaking and now it's going away. And you have a break before your next contraction starts. That is the interval, the time in between each contraction. And it's amazing. It's a God gift to us as women because we get a break between each contraction. And it is the most amazing time when you get to just close your eyes, take some breaths, maybe fall asleep if you've been in labor for a little while, and just break before your next contraction. So that's the interval. When you are in active labor, that interval will not be more than 5 minutes. It might be 3 minutes, 2 minutes, but it's not going to be more than 5 minutes. When you first notice that you're starting to go into labor, that interval might be 30 minutes or 20 minutes or 15 minutes. But as you progress through labor, that interval is going to come all the way down to less than 5 minutes between each contraction. And so when you start to feel like, okay, labor's starting today, I can really feel like my contractions are starting to get more consistent, you need to write down that time when labor starts so that you know how long you have been in labor. Each contraction is going to last a certain amount of time. When labor first starts again, it might be that they only last for 30 seconds before the contraction's over and you have a break. But as you progress through labor, those contractions can last anywhere from 30 to 90 seconds, and they're probably going to last more like 60 to 90 seconds. But again, it's amazing because we as women can do anything for 60 to 90 seconds. So you start that contraction and you start your timer and you think, okay, I can do this. The pain is hard, it's painful, but I can do anything for 60 to 90 seconds. And then it peaks and it starts to relieve and you have a break. So that's the timing that we're talking about. Less than 5 minutes, so maybe 3 to 5 minutes, interval in between, and lasting 30 to 90 seconds with each contraction. Dr. Boyd talked about pain with active labor. So when your labor first starts, you're gonna feel some achiness, like, I don't really like this. I feel like I'm having a really bad period, and I really don't wanna talk to anybody because it doesn't feel good. Okay, I'm fine now, I can talk to you. And that's not pain. That is just, oh, I'm uncomfortable. But when you get into active labor, it is going to be painful, where you can't talk to anybody, you can't think about anything except for, I have to breathe, I have to breathe. You might be down on your knees. You might feel like I'm gonna be out of control. And so that's where we want to prepare you to have the right breathing and relaxation techniques for labor. You do not have to be out of control. Each contraction with the pain has a purpose for you to get to the top of that mountain where you say, I did this, I am courageous, I am capable, and I am satisfied that I delivered my baby and I'm holding him or her in my arms now with success. And so when you think about that, that each contraction has a purpose. Each painful contraction is the uterus squeezing your baby to get your baby down the birth canal and into your arms. That is gratifying. So through each painful contraction, if you can learn how to cope, and we want to help you do this through our online course and our personalized coaching, you can do it. And so the third part that Dr. Boyd talked about was the actual time that you have been in labor. And it's super important because if your contractions start in the day and you feel like, yeah, this could be labor because the interval is consistent and they're starting to feel more and more uncomfortable, but then all of a sudden they go away, well then you have to kind of start the process over again because that was just false labor, false alarm. So you want to put down on a piece of paper what time labor started, and before you even get to active labor, it might be 6 hours, 8 hours, 12 hours. So it can be different for each woman. Some women experience it within just a few hours. That is not common. So just expect that it could be 6, 12 hours before you really get into that active labor and start heading to the hospital. So that is the normal process of labor. But we women know that life doesn't always go as textbook. Each woman has kind of a different experience. The body is still always trying to do the same thing. Get your baby from your uterus, your womb, out into the world. But sometimes the body has to take different routes. And as women, we think that because we took a different route, we feel defeated and we feel like we're failures. And I do not want to hear any mom say that, because you are capable, you still carried this baby, and you might have delivered a different way than you had anticipated, but you are not a failure. And so these terms that Dr. Boyd used, failure to descend and failure to dilate or progress, can feel so defeating. And I want to clarify to you that that is medical terminology, it is textbook terminology, and it is not you failing. Your body has things happen, and there are circumstances that happen to us as women, and what are we going to do with those challenges? That is where you can one day look back and say, did I fail or did I succeed? How did I handle that situation? And that is what I want to talk to you about, is how you handle the information that is presented to you. So failure to dilate or failure to progress. The cervix is closed tight while you're pregnant, and it has to start to open and open and open and open and open all the way to 10 centimeters because your baby's head has to actually come through the cervix and down through the birth canal and deliver. And so it needs to be all the way open. And there are things in our body called hormones and chemicals that help that cervix open. And so how do we control that happening? Well, it definitely happens without you controlling it. Your body will do it automatically. But when Dr. Boyd said failure to dilate, what he's saying is that cervix was opening and then all of a sudden it stopped opening, and it stopped at 6 centimeters or 7 centimeters, and the baby can't fit through that hole, so the doctor decides to take you to C-section. Let's talk about some things that you can do to help the cervix open. The first thing I want to talk to you about is what Dr. Boyd said, stay at home as long as possible. What in the world does staying at home do for my cervix? Well, it has to do with your brain and how you handle stressful situations. We have a hormone released into our body called oxytocin, and you've probably heard Pitocin. That is a synthetic form. When you go to the hospital and they say start Pitocin medication to help labor get going. Well, your body does it normally, and when you are relaxed, when you are in control, when you know how to cope with anxiety and stress and hard things, when you have the lighting how you want it, just mood lighting, dimmed lighting, if you have music, very relaxing music, or just no music, just quiet. If you have a temperature in your room where you're not hot, you're not cold, you're just right. If you can get up and walk because exercise helps you relax. If you can get in the shower and take a hot shower. These are things that can relax you and help oxytocin release into your body and really help your cervix progress. Then all of a sudden you get to the point where you say, honey, we got to go to the hospital. I am ready to deliver this baby. I'm ready to birth my baby, because you have motherly instincts that will tell you it is time. You get to the hospital and there's bright lights. It is freezing cold, or you're just sweating because you're so hot. And they're handing you all these papers to fill out and you can't even remember how much you weigh, or what in the world, honey, can you just fill this paperwork out and just do everything that I can't do? And then the nurse is coming in and checking you, and they're laying you back, and then they're setting you up, and then they're just doing all of this stuff. And all of a sudden your brain freaks out and you get into this fight or flight mode, and you are just gone. You're like, I can't do this. And your cervix gets scared too. And it says, heck no, I'm not opening anymore. We have to conserve all of our energy because something is wrong. Well, this is where I want to encourage you to really plan before you go to the hospital how you are going to handle all of that. Making sure that you take your electric candles or your lights to hang up so that you can have mood lighting. When you go in, making sure that you talk to your nurse about your birth plan and wanting a very quiet and relaxed environment. And hospitals are really catching on to this research, and so there is much more of this push towards keeping the lights low, not interfering with mom if she just needs quiet, letting her get up and walk and move how she wants to move, getting on her birthing ball, getting in different positions, allowing the doula or the husband or caregiver to really massage mom in different positions so that she's comfortable. And so with this respect now of hospitals and mothers' birth plans, we're starting to work together more so that moms really can progress in labor more effectively. And I do want to mention, when the doctor comes to you and says, you're not progressing, we got to take you to C-section. You, mom, have the say. You are in control. Don't feel like you are presented this decision, but you don't really get to make the decision. You are intelligent. You can make the choice when you are informed correctly. And so I want to encourage you to get all of the information that you need, calling the hospital to see what their C-section rate is, talking to your doctor about their view on C-section, watching our C-section video, watching our videos on how to help labor progress, and really being in control of the situation so you can say, I'm informed and I have the choice. Really talk to your nurse and your doctor. Don't feel pressured to just go right off to surgery. Again, you don't fail if you go to surgery. It's just a different route. It's a different road to go down. The end goal is to get your baby in your arm safely. And we want that for you. But we apparently also want you to have the natural, very gratifying, satisfying, courageous, natural birth that you desire. And so we are ready to help you down that road. We just need to get these tools in your hand. Click the link below, come and sign up for our free online class where we will walk you through 4 simple steps to a fearless labor and delivery. We will see you on the next video.